Right, imaging the anterior segment with our smartphones is the next topic. This is probably the most important part of the eye to document, given that the majority of pathology in the equine eye is in the cornea or the anterior segment, the cornea lens and iris. So, some basic skills. It's important for us to use to get the most out of imaging this important part of the eye. And the first sort of concept, I guess, is to try and use our images to tell a story, to actually tell a clinical journey of this eye, rather than just a single image. So don't expect a single image to represent everything there is to tell you about this case. Second point is that distant direct ophthalmoscopy, fonioscopy, is going to be one of your most important tools. So getting that technique nailed is very important. This is where we're also going to introduce a new concept, which is using a macro lens to overcome the limitations of our smartphones, which are generally very poor at macro photography, to give us really highly magnified views of the anterior segment of our patients. When we start to use macro photography, then using a macro lens attached to our smartphones means that we generally can't use the light on the phone. There are some exceptions, such as the iPhone 8, 7 Pluses, and some of the Android phones. Also, this is an advantage to us, because using our lighting separate to our phone allows us to change the angle to highlight lesions and see things we wouldn't otherwise normally see. This is how we use lighting with a slit lamp by a microscope, which is the commonest and most important tool used by ophthalmologists. And we can also use our slit lamps in combination with our macro lenses to take a slit lamp photographs we probably won't cover in this next part. This little tiny animation running on the side is produced automatically by Google Photos Assistant. So my photos get uploaded to the cloud and sorted by date and location, and Google would take what it thinks are things which are related in time and makes them into a little video for us. It automatically makes little case videos. This is a horse we're going to meet shortly. This is Trigger. We're going to tell you a story using photographs and try and explain how we use the camera to get these images. So this is a horse which has had a probable blackthorn perforation of its cornea. We're using distant direct ophthalmoscopy, phonioscopy using our iPhone, and so the lights turn on continuously, and we're using digital zoom to get the eye to fill the eye. The cotton buds are there because they're soaked in proximeticaine, local anaesthetic, which is ready to us to desensitize the dorsal eye before we do subconjunctival injections. So we can see a shadow in the center of the cornea, and also see there's a ring-like shadow, and we can see the fluorescein as well. So this raises the question, is there a corneal infiltrate there? Is there a corneal foreign body there? So those questions we now have to try and answer using the camera. So we're now going to use a macro lens. We attach this to our camera, a phone, and we can now see much more detail. We can see these little tiny dots. We can see the individual cells on the surface of the cornea. We can see this is the region of the dark area, and we can see that aqueous humor is dribbling down through the fluorescein into the lacrimal lake between the cornea and our eyelid. This is called a Siebel positive test. So there's aqueous humor leaking from this eye. Now, foreign body, I can't see in this view. I can't no longer see. It doesn't appear to be so dark. I can see the edge. The epithelium appears to be underrun at the edge. To get this image, we've held a light pen torch from the side using a macro lens on our camera to get nice and close. The Siebel test is much more obvious. We use a video rather than the still photograph. So we flooded the eye with fluorescein. We're opening and closing the lids to pull that fluorescein from the lacrimal lake up across the hole, and that shows beautifully the Siebel positive aqueous humor leaking down into the Blackamoor Lake. This is using a macro lens and a video mode, again holding the light from the side, so oblique lighting. Now we're still not quite sure whether we know it's leaking now, but in the first image we did distant direct. We were worried there was a dark area at the presumed area of perforation. So what we've done now is we're using our macro lens again, and this time with our torch, rather than having it obliquely, we've moved the light so it's almost coaxial. So light's bouncing through the cornea to illuminate from behind the cornea. And then when we do this technique, you can see that the light passes through both the stroma and the area of the perforation, which tells me that there's no corneal infiltration, which is good, so no signs of infection, but also no retained foreign body. So very useful technique. We would do this technique with satellite biomicroscopes all the time. We can replicate those techniques using the macro lens. We can continue to use our phones. This is now a different phone. This is an older model, an iPhone SE, and this is just in the clinic. So this horse had a corneoconjunctival transposition. So there's the corneal perforation in the centre. This piece of cornea has been harvested dorsally and slid down into a keratectomy to close the wound, and the conjunctiva, which was up here, dorsal bulb of conjunctiva, gets pulled down to fill the hole. So the clinic staff are trained to use their phones with the lights on, take photographs, and this is an unstated, unblocked horse, and we're using computer reflection. They can message me these as often as I need to. We can train the owners to this as well, and get lots of information about whether we think this eye is going well or going badly. So distant direct fonioscopy, how do we actually do the technique? We talked a bit about it now. Well, before we had smartphones, we used to try and still mimic this technique using our normal cameras, and really to get this, unless we had some very fancy flash attachments or digital SLR, we would use our small compact camera, just getting a little bit further away. And we could get lovely photographs such as this. Traditionally, you use ring flashes for digital SLR, but actually you start to get quite big, bulky apparatus. So this is a horse who's had cataract surgery. This is the intraocular lens in place. This white area here is outlining the lens capsule rupture. This was a posterior lens capsule rupture we see not uncommonly in young horses as a cause of sudden onset cataract. And we can see the edema adjacent to the corneal sutures just at the top there. So before smartphones, we'd use our compact phones, compact cameras, sorry. They have to get a little bit away, far enough away from the eye so that actually we could get the fundic reflection, and then have to crop the image. But we've got nice images. Now, however, we can do that with our phones without having it much more easily. This is the technique itself. So we're mimicking distant direct ophthalmoscopy, which is normally an arm's length technique about a foot away. And what we're doing is we're using the defocused fundic reflections and using that to highlight any changes in opacity or changing refraction. So to do that, we turn the torch mode on our camera using an app which allows us to do so. If we haven't got an app, then our video mode and turn the torch on, and then we get then we can hold the phone away from the horse's eye, so we can still so we can actually see the whole eye, and then we're going to zoom in to get the pupil, the eye to fill the screen. Once we've got so we can see the top left picture here, the phone's probably about 10 centimeters away from the horse's face at this point. We've zoomed in to get to fill the eye. We can see the pupil reflection, and then we're going to move it from different angles to try and highlight opacity and get them to move around. What we're doing is mimicking the technique we'd use with our direct ophthalmoscopes. So this is doing the same technique using ophthalmoscopes. So I'm looking from the bottom up, I'm looking from caudally to nasally, and then even further caudally to nasally. So we're swinging ourselves around the horse using our direct ophthalmoscope or our phones, deliberately trying to interrogate that visual access, that light corridor through the eye, as many angles as we can to see if we can identify pathology. These are the sort of images we can get we mentioned before about changing the light intensity. If we drop the light intensity really low, we start to see very subtle changes, these dark shadows, these little tiny, look like pine needles on the surface of the eye. These are just individual collagen fibers at the base of a keratectomy site. They're all transparent, but at very low light intensities, they start to appear as opacities. As we increase the light intensity, or the exposure on the camera, they will start to disappear. We can see the edge of the keratectomy site, which again looks dark, and the edge of the epithelium and the vessels. Same eye. We've now got more light. We've also added some instant light from the side, and we can see that the vessels still remain opaque, but actually we can now start to see more information about the front of the eye. So adding this oblique lighting allows us to highlight an area here, for example, which is a suspicious area of corneal infiltration. Another keratectomy site here, either on the right-hand side with just coaxial light, and we can see light passing through this bed of the keratectomy, and then we add in tangential light, and actually you can suddenly see the surface of the cornea has this white appearance, which helps us to highlight any changes to the anterior cornea. So we're getting information from both sorts of light, so both transparency and reflectivity. So smartphone macro photography next. So this is one of the really fun parts of looking at the eye. You can get some really amazing, see the eye in a way you would not normally do unless you had a slit lamp by a microscope, which is a very important tool, but not available in every practice. And what we're trying to do is using our smartphones, we're trying to mimic the use of this tool. This is the slit lamp biomicroscope in use. Left-hand side, we can see the binoculars, the actual magnifying part of the instrument. Then we have a light source on a swinging boom, which moves to different angles to allow us to illuminate. So actually looking at the anterior eye here. And then what we're going to do is we'll mimic that by using the macro lens on the camera and a light from the side to give us a very similar view and allow us to record it as well. Macro lenses needn't be expensive. If you go to the website, theiphone.com, there's some links to the macro lenses I prefer to use. These often sold. They're sold on Amazon very freely. They're often sold in the garages actually, alongside other lenses. And a few tips, I guess. If you're going to buy one, it's worth buying a black one. You can buy them actually attached to the case of your phone, which is very useful. You can get ×10 magnification and ×20 magnification. ×10 is fine for a horse. ×20 is perhaps a little bit too close, but having both is even better. If you can get slightly more expensive ones with glass lenses, then they become coated and they produce reflections. That's ideal. And also the small size to these macro lenses allows you to sometimes use the light on your phone as well. These are sort of images we can get, and also it illustrates the importance of having a black lens. This is a close-up of the anterior surface of a horse's iris. It's got an iris cyst in this eye. And this is just before and after laser photocoagulation. So we've just heated up the cyst wall with a laser, and you can see that individual cells dropping down through the aqueous as the cyst dissolves. And you can see this white reflection on the eye, which is actually this is a silver macro lens. If it's a black macro lens, we wouldn't have seen those rings and ruin. One of my favourite photographs. To mention case-fitted lenses, you can get lenses with macro lens. You can get cases for your phone with the lens attached. It's a very convenient way of adding your lens to it. The distance between the light and the lens will affect whether or not you're able to use the light. So on this phone on the left, actually an iPod, if you put the macro lens on, you can see it covers the light, which means we can't use the on-camera light easily. This is the iPhone 7 Plus. If we put the macro lens on either of those lenses, they're far enough away that we can still use the light on that camera, which allows us a very easy way of using illumination and magnification at the same time. Just an example, this is 3 iPhones. The first one's the iPhone 4S, and you see how super close the light and the lens are to each other. If you've got an old iPhone 4S and you're in a drawer somewhere, and dig it out, because with these are so close together, you can actually image the retina of a small animal like a dog or a cat. And there's an iPhone 6 above it and the iPhone 7, and we can just illustrating on the right hand side. With the iPhone 7, we can have the light on at the same time as you use the macro lens, whereas for the iPod, it gets in the way and causes problems. So some sort of light source in addition to the on-camera light is important. So I prefer, this is my favorite tool, this is an LED lenser head torch. It's got a focusable beam, and also it's got a rheostat and a very small headpiece, so I can hold that in the palm of my hand whilst holding the camera in the other. So there's 2 ways of using light, which is mentioned already. We can either use the on-camera light. This is the iPhone 7 Plus. So all I have to do is turn the light on, put the macro lens on, and position it backwards and forwards so I can get a nice picture. If you look at the quality of the image, it's nice. But when I look at the other image, where I'm not using the on-camera flash, but using a light from the side, oblique lighting or modeling light, we can see that this image is much more three-dimensional in appearance, because we're getting the shadowing. So having an oblique light will actually show us things which we can't see with coaxial light. And being able to do both is very, very useful, as in Trigger's case at the beginning of this talk. In order to focus that camera, without the macro lens, we rely on autofocus, or tapping the screen, or we can use software to focus automatically. But with the macro lens, the autofocus will not work in the same way as normal, which means in order to focus, we move the camera backwards and forwards. And this is exactly how we would focus our slit lamps. So in order to focus our slit lamps, we support our slit against our hand and against the horse. That allows us to make very small micro movements to focus on the front or the back of the cornea, for example. And with our lens attachments to our phones, we can focus both on the front of the lens, sorry, the front of the cornea and the back of the cornea by making these very small micro movements. In order to do the same, to make these micro movements, you need to be able to support the phone. So you have to be a bit creative in how you hold your phone and how you position your lens on the phone itself. So it's an important point is to rest your hands on the horse, rest your phone on your hand, and then that allows you to move backwards and forwards to very tiny movements to focus on exactly the right part of the eye. Once you've found the area of interest, you can then zoom in, as we are having this right-hand image, to try and make sure that you're clearly in focus before you take the image.